In this video, I would like to discuss some of the revision procedures which can be performed after initial weight loss surgery. It is a common misconception that once weight loss surgery is performed, there is nothing can be done if patients gain weight back. Patients and doctors alike frequently think that if the operation does not provide good result, it must be patient's fault. In fact, this is furthest from the truth, and there are many options available to boost effectiveness of weight loss surgeries. Common weight loss procedures such as gastric band, gastric sleeve, or gastric bypass may lose their effectiveness over time, resulting in weight gain or insufficient weight loss. Let's start our discussion by addressing common problems with adjustable gastric band or a lap band. Frequently, patients with the lap band are having difficulties losing weight and seem to frequently have trouble finding that perfect level of restriction. They either have vomiting or don't feel the band at all. One of the first steps we take if patients have such issues is to perform adjustments utilizing X-rays. The X-ray study called fluoroscopy helps determine precise position of the band and whether the band is too tight or too loose. Frequently, the band shifts up on the distal end of the food pipe and causes difficulty swallowing without making patients feel full. In this case, the band will need to be either repositioned or removed. Patients who had lap band and have difficulty losing weight could be converted to either gastric bypass or gastric sleeve. In this case, the band will have to be removed and sleeve or bypass surgery would be performed 8 to 12 weeks later. This approach ensures resolution of scar tissue in the stomach and provides for a safer surgery. With gastric sleeve, patients may gain weight after initial weight loss. This usually occurs due to one of the two possible reasons. One is stretching of the sleeve, and second is increased transit of food through the stomach. Patients who are experiencing weight gain after sleeve should have a camera examination of their stomach called upper endoscopy to see if the stomach is stretched. If stretching of the stomach occurs, it can be corrected by revision surgery. During a revision procedure, we remove stretched part of the stomach and bring the stomach to its original size. But what if the sleeve has not stretched? In that case, the most likely cause of weight gain is increased passage of food through the stomach, and conversion to gastric bypass might be the solution. Gastric bypass patients may experience weight gain after their surgery as well. Some weight gain is normal, as body tries to compensate for a decreased absorption of food after gastric bypass by processing food more efficiently. However, if weight gain is substantial, more than 30 pounds, then something needs to be done. Frequently, patients complain that they don't feel full anymore and they can eat larger portions. This is caused by stretching of the connection between stomach pouch and the intestine called anastomosis. The anastomosis should be tight so that the food is delayed in the stomach, making patients feel full. If the anastomosis is stretched, the food passes into the intestine much more rapidly and there is no feeling of fullness. In addition, rapid passage of food into the intestine makes patients have dumping reaction such as diarrhea every time they eat. We have several surgical options available to treat stretching of the bypass anastomosis. One of the procedures involves tightening of the anastomosis via endoscopic camera without any surgery. The other procedure tightens the anastomosis through a minimally invasive laparoscopic technique. Both of the surgeries can be very effective in restoring function of the gastric bypass and reversing weight gain. In addition to stretching of the anastomosis, gastric bypass patients can develop stretching of the stomach pouch and intestine, which result in increased capacity and decreased portion control. These problems can be diagnosed by endoscopy as well and subsequently corrected by surgery. These are just few examples of how weight loss procedures could be modified at a later time to make them more effective. Of course, each case is unique, and each patient deserves an individual approach in dealing with problems associated with weight gain after surgery. For more information, please don't hesitate to contact our office. Thank you.